We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says, what causes a person to scream while having a seizure?
Not really sure. You know, a seizure is hyperactivity of the brain, so depending on where the seizure is, certainly anything is possible. I think we're all familiar with people falling to the ground, shaking all over, losing consciousness, foaming at the mouth.
Yeah.
Sometimes that does happen, but seizures can be very subtle. Sometimes people don't even talk. So I think anything neurologically can happen.
It can be quite scary if you're the person that's watching somebody else have a
Absolutely,
seizure.
especially if it's the first one that you've ever had. Now, once you've been diagnosed with it and you're on medications, we don't necessarily re-hospitalize these patients or do another workup. It's something you learn how to live with. Certainly, if you have any concern, call 911.
Okay, what are some symptoms of a GI bleed?
GI bleed, gastrointestinal bleeding, basically bleeding, maybe blood in the water, blood on the paper towel. A lot of times patients have abdominal pain and cramping. They feel like they have to have a BM. They go to the toilet and there's just blood in the water. So that's GI bleed. Lower, that is. Typically an upper, coughing up blood, throwing up blood. That would be the symptoms of a GI bleed.
Okay. What's the best way to get rid of corns on your feet?
Those are basically calluses. Probably buy bigger shoes. You know, style can sometimes be detrimental to your feet.
Don't wear high heels if you're a woman?
Well, you can, but if you have corns and you're concerned about that, that may not be good for you because it's basically related to friction. So try and change your shoe wear. Certainly you can get to a podiatrist or maybe someone else to shave those down. There are a lot of over-the-counter products to place on the corn to reduce friction, so all those things are possible. But typically change the shoe wear.
Okay, what could cause someone to itch at night if it's not bed bugs?
A lot of times medications can cause that, allergies to all sorts of things. Sometimes when the weather changes like now, dry skin is a big cause of that. Dehydration if you're on diuretics. A lot of times we start off with, you know, a good lotion. Sometimes do a little blood work, make sure they have no thyroid disease. Sometimes we might use a medicine to control the itching, but try to figure out why you're having itching.
This woman has had an upset stomach for the past 7 days. She also has a low-grade temperature as well as lower back pain and a knot just under the right rib cage. Any idea what it could be?
Abdominal pain can be a lot of things, and certainly red flags make me more worrisome. Fever is one of them, or moderate pain that doesn't go away if they're bleeding. Having problems keeping their food down, those are some red flags, and we'll certainly get to the emergency department or minor care to get some x-rays and some blood tests.
Okay, another question. What can you do other than medication or surgery to help an enlarged prostate?
You know, there's some medications that actually help reduce the size. I think a lot of people don't do it because they don't feel any different initially. It's been a hard sell. Those medicines have been around for years. Sometimes saw palmetto can help with the symptoms. That's over the counter. So Avodart is one medication that we've used to try and help shrink the prostate. Proscar is another one. So those are some non-surgical treatments.
Now, would you mix the saw palmetto with your prescription medications?
Not necessarily. There's no reason to. These prescription medications have been proven to work. A lot of people looking for other alternatives, non-prescription, if you will, natural, if you will. Saw palmetto is one of those options. It works for mild to moderate disease.
Okay. My doctor put me on a depot shot in the 22nd and 23rd and still haven't stopped. When does this shot start to work? Typically
in several days. If certainly your symptoms don't go away, call the physician's office or get back with them. Sometimes medications don't work. You need a different medication. That goes for anything. If you don't get better, anytime you see a physician, get back with the doctor. All right, Dr. Levine, unfortunately we are out of time, but we appreciate you taking the time to answer everybody's question. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFDM News Facebook page.